Hello. Today we will discuss my essay, Red Tape Purple Pain Denied by Design. We will discuss how hard it is to receive Social Security disability benefits when diagnosed with lupus and why benefits should be streamlined so that people can receive the financial help that they need. Let's talk about what lupus is. Lupus is a disease that not many people understand. It is a chronic autoimmune disease that can affect any part of the body, including organs, any system, and tissues. Lupus is known as the invisible disease because it is hard to diagnose since no two people are alike, meaning different signs, symptoms, and the effects it has on everyone is different. According to the Lupus Foundation of America, there are an estimated 1 million people living with lupus, and still there is a lot that isn't known about the incurable disease. There are four types of lupus: cutaneous lupus erythematosus, drug-induced lupus, neonatal erythematosus, systematic lupus erythematosus, also known as SLE, which can affect any parts of the body. For my presentation and essay, that is the form of lupus that we will discuss. Now that we know what lupus is, let's talk about the effects lupus has on the body. Imagine waking up most days to non-functioning legs or arms, or having skin rashes or lesions with no explanation, or maybe a huge patch of hair in a comb while grooming. What if being outside in the sun causes great discomfort or a flare-up occur? What happens when the immune system, which is supposed to protect the body, actually fights against it? Those are the effects that lupus has on the body. Some of those signs and symptoms are skin lesions, a butterfly rash that spans across the face, hair loss, weight gain, tiredness, excessive swelling, dizziness, blood clots, loss of muscle mass. Or what about the effects on the organs such as kidney failure, heart disease, liver failure, or lung issues? How can a person maintain a full-time job while experiencing the pain and discomfort that lupus causes, especially when the person does not know when certain symptoms will occur? Working with an incurable disease such as lupus is very difficult since a person never knows when a flare up will occur. Some jobs have protections such as FMLA, short term disability, and long term disability. However, those programs only work if you have paid time off in which you will receive money. If you do not have paid time off, then you will not get paid. Therefore, that is why Social Security benefits is needed, and for those jobs that do not offer those benefits. In order to prove disability, paperwork must be thoroughly filled out to prove lupus affects the patient's life. Any tests such as x-rays, biopsies, CAT scans, and MRIs must be included. No information should be left out. The doctor must include anything the patient relates to them and anything that they find in their workup. According to the Social Security Administration, a person must have either two organs or a body system that are soberly affected, along with two severe constitution symptoms such as fever or fatigue, or two constitutional symptoms along with limited activities or limited social functions in order to be approved for Social Security benefits. That is a little much. A person with lupus still suffers a lot without going through any of these severe symptoms. Being able to work a full-time job is still affected since symptoms can appear at any given moment. Those symptoms can be severe, preventing someone from working for little or even a prolonged amount of time. Therefore, Social Security benefits must be available for those who need it. The first step of filling out an application for benefits is often denied. If so, a person can appeal for a reconsideration period. If that is denied, then an administrative hearing can be held. The next step would be an appeals council, which can lead to a judicial hearing. By the time a person completes these steps, the individual would have already lost their job and therefore have no financial support. From what we've learned in this presentation, lupus patients have it hard, even with maintaining a job. So, what can the Social Security Administration do? The Social Security Administration could come up with a program to assist patients diagnosed with lupus and experience severe flare ups. There could be a proposal for partial temporary disability benefits where a person could apply and receive benefits when it is known there will be an extended period of time off work. They could be from 2 weeks up to a few months to be determined by the Social Security Administration. This would supplement income for that time frame. By recognizing the fluctuating yet disabling nature of lupus, policymakers can help patients alleviate financial burdens and reclaim a sense of stability, ensuring those with lupus live a more comfortable life. On slide 4, you may have noticed that I wasn't as enthused as I was on the other slides. I could have re-recorded but decided to leave it as is. I myself have lupus and woke up that morning with chills, a headache, body aches, could barely walk, and as I recorded, my head rested in my hands. These are the things that I am subjected to often. It took me 2 years to receive disability benefits, and that is how I know personally that streamlined benefits would help a person with lupus tremendously.